Dire situation in North Idaho has now enacted crisis standards of care in 10 hospitals, including Kootenai Health. Thanks for joining us. I'm Aaron Luna.
And I'm Nia Wong. The Delta variant continues to spread throughout the U.S., and our communities are seeing huge spikes in cases. In Kootenai County, 108 people are in the hospital being treated for COVID. Kootenai Health breaks that unfortunate record every day. 39 of those patients need critical care. Now, Idaho is using crisis standards of care for the first time. It means if you go to the hospital, you likely won't get the kind of care you'd expect.
Rania Kaur is live in Coeur d'Alene, where health officials are pleading for help from the community.
A lack of space and staffing have stretched Kootenai Health so thin, they're on the brink of making tough calls, deciding which patient has the best chance of survival, and putting patients in rooms and departments not designed for their level of care. They're at a point they thought they'd never be. It's a situation no hospital ever wants to be in, and a place Kootenai Health has never been before.
We are beyond the point where we can continue to offer care in a normal setting with normal levels of care. So that is what crisis standards is about, and we hope that this day would not come.
For the first time in state history, 2 regions have enacted crisis standards of care. Panhandle Health District, which includes Kootenai Health and Bonner General in Sandpoint, and North Central Idaho, which includes Gritman Medical Center in Moscow, among others. Now, if hospitals lack space, they'll convert conference rooms and other spaces to hold patients, and they now may have to ration life-saving supplies.
When we get short on certain supplies, oxygen or ventilator equipment or what have you, that may require us to make some tough decisions about who gets what when.
It's a situation John Kreitz says there is a solution for.
The treatment for this is prevention. The only thing we have is a vaccination. So anyway, I hope people will calm down, listen to their doctors, and get things done they need to do.
He's one of few people we saw masked today in Coeur d'Alene. He also happens to be an urgent care physician.
We're all trying our best. We're overwhelmed. We're tired, all those frustrations, but it's truly a war on information right now.
In that war of information, the casualties are ending up within the walls of these hospitals.
We're near the limit of what we can handle in this facility. We've done a lot of things to expand our care, to take care of more patients, but it keeps growing. And if we had everyone in the community vaccinated, we would not be in this position.
7 patients today are at their health resource center. That's the conference room that was converted to hold patients. Kootenai Health has already started preparing for the eventual surge that could come from school starting. While they say kids may not end up at the hospital, their parents and grandparents will.